As COVID-19 continues to spread around the world, the head of Africa CDC is sounding the alarm about the need for a vaccine. The continent is nearing 2.2 million reported cases of the virus and counting. Cara Anna is an Africa correspondent for the Associated Press. She's here now to tell us about the obstacles the entire continent is facing. Thanks so much for being with us. Now, we know that COVID-19 has obviously affected us here in the U.S. and in other countries around the world, but tell us from your perspective, how has the virus impacted the continent overall? What's happening on the ground?
Well, keep in mind, this is a continent of 1.3 billion people, 54 countries, and so when you try to give a snapshot of a continent like this, it's certain countries have, a lot of cases, such as South Africa and some of the North African countries, and then some countries really have a relatively low number. I guess the overall, I should say, is that the continent has done better than people have expected. They had really strict early lockdowns, but they ended up hurting the economies here, and so as cases begin to rise again, you don't really see the movement to do such strict lockdowns again. One thing here is that testing remains low. So when you look at case numbers, you have to keep that in mind. There have been about, as you said, 2.2 million confirmed cases and more than 50,000 deaths.
So, here the whole talk is about how quickly we can get this vaccine out and how, the time frame is sort of breaking records. A vaccine has never been developed in such a short period of time. And then we hear from your reporting that the head of Africa CDC said a COVID-19 vaccine might not be available in Africa until at least the second quarter of next year. What is holding things up, and what are governments doing about it?
Well, they're trying. They're trying on all fronts, but they have been warning for months that they're very worried that Africa is going to be at the back of the line, so to speak, for vaccines. Just that, countries were near the back of the line for things like COVID tests. And then going back a bit further in history, they have the really scarring memories of the continent being last in line for HIV drugs, affordable HIV drugs. And the Africa CDC director in particular has said that, the memories of watching millions of people die waiting for HIV drugs to be available. This time around with COVID, they just don't want to see this happen. But the thing is, they are reaching out to, they've said they're speaking with China, they're speaking with Russia, they're, encouraging countries to sign up for this COVAX initiative. Any way possible to get vaccines to the continent, really. But actually, the Africa CDC earlier today had a briefing saying, in fact, Africa perhaps might not even see vaccines before the second quarter of next year. So they've sort of pushed it back a bit. So there is a lot of concern.
Another concern, Cara, as you know, health officials are also saying that about 60% of the population would need to get vaccinated in the next 2 to 3 years to create herd immunity. When I was a foreign correspondent based in Nigeria, one of the hardest stories I ever did was on folks, we have anti-vaxxers here in the United States, but in Africa, it's generally a much different situation because living conditions there are sometimes inadequate, and people who resist getting vaccines for a variety of reasons put the rest of the population at risk. Is that also something that is being considered?
Actually, the WHO Africa team had sort of a briefing not too long ago this afternoon on misinformation, on the threat of misinformation. The people acknowledge that, yes, in general, people in Africa are more accepting of, getting the childhood vaccinations and so on. But they are worried about strands of misinformation that are coming from places like, they said, the US and the UK, and they are people in countries such as Kenya, Nigeria, South Africa, places where the internet is especially, probably the most developed and widespread. That sort of information is starting to take off in certain cases. And so they are just really worried. And I believe someone from the UN told the briefing that, concerns are high enough that they're worried that, you won't even find enough people to reach herd immunity to reach that 60% target that African health officials are saying need to be vaccinated in the next 2 or 3 years. And they say if it takes longer than those 2 or 3 years, the risk is that COVID becomes endemic in some communities. And we're talking about, Africa is a very heterogeneous place, but there are a lot of rural communities where health centers are just not equipped at all. And just to mention, with the holidays coming up, that's their next fear. A lot of people are going to be leaving urban centers and going back home to rural communities. And they say this could be the time that the virus really does spread into areas that are not prepared. So the faster they can get the vaccine here, the better.
Many countries in Africa, though, have experienced dealing with dangerous and deadly diseases. Last month, Congo declared the Ebola outbreak in the west part of the country was over. How did they do it, and what lessons did they learn that could maybe be applied to the fight against COVID-19?
It's interesting. They had, of course, Congo had 2 recent Ebola outbreaks, one in the west that was pretty shut down within months, rather quickly. But then they also had one that in eastern Congo that went on for, I believe, a little over 2 years. And of course, the difficulty there in eastern Congo was the threat of deadly attack by rebel groups. There are multiple rebel groups. That outbreak essentially took place in what people compared to a war zone. And so just between those 2 outbreaks right there, you have some lessons. It is a lot easier, of course, to tackle a pandemic, when there is safety, when there is security. Not to mention the, people buying in and wearing the face masks and taking the public health measures. There are a lot of other factors in different parts of the continent here that will be challenging. And then, of course, logistics, certain things like the cold chain, so to speak, just the capacity to have freezers that are cold enough that can protect the vaccine. Some of these vaccines, like the Pfizer one, that requires minus 70 Celsius, I think. That's another challenge. And just to go briefly back to Ebola, the Africa CDC has said that, during the terrible West Africa Ebola pandemic outbreak, they said, they did manage to set up a storage network at minus 70 degrees Celsius. But again, that was very localized. And the idea of trying to roll something like that out across the African continent, they call extremely challenging.
Cara Anna, thank you so much.
Thank you.